Welcome to the Pelvis Party, a health talk show in partnership with Olmsted Medical Center, where experts and guests dive into real conversations about hormones, sexual and pelvic health, and everything in between. We're creating a space for honest, judgment-free talk. There are no dumb questions, no awkward topics, and definitely no shame.
Hi, everybody. My name is Becky Monpetit. I'm with Rochester Local. This is Dr. Melissa Richards. She is the chair of the OBGYN department at Olmsted Medical Center. And this is Britt Marshall. She's with marketing at Olmsted Medical Center. And we are Pelvis Party. We are coming to you on a semi-regular basis, and we're going to talk about all things women's health, our pelvises, everything that goes on down there. We are three friends, and we have gotten to know each other and talked all about this. It helps that we have an expert who likes to share her expertise. So we're going to do that. This month is actually Bladder Month. Who knew there was such a thing? So why don't we just jump right in and talk about peeing your pants?
Whoop, whoop.
Peeing your pants, also known in the medical world as
urinary incontinence.
Urinary incontinence. I feel like a lot of people will talk about this, like even in passing, going out to coffee or whatever, or like jumping on the trampoline, people are like, I could never do that. Or like people who go running and they're like, I cannot run anymore because I pee my pants. Do your friends talk about this?
Oh, yeah.
Oh, yeah.
We were at the gym, a girlfriend of mine, at the gym last weekend, and we were going to do jump rope, and she's like, I am not doing that. I'm like, why? Why aren't you going to do that? Oh, because I leak a little every time I jump.
And I feel like, it's something that we kind of joke about in memes, on the media, or people will say, oh, I can't pee my pants. But no, actually, it's actually real. And a lot more people struggle with it.
Yeah, it's a huge issue.
Yeah.
I hope a big theme of this podcast is like, do not settle. Like, just because it's normal doesn't mean you have to deal with it.
Right.
What?
Right. I think that's a huge one too, is talking to people and they're like, oh, I just don't X anymore. I don't run. I don't jump on a trampoline. I don't go whatever because I don't want to pee my pants. It doesn't have to be that way.
It's so weird.
Okay, so talk to us a little bit about.
Okay, so there are like 3 little clubs of urinary incontinence or peeing your pants. So I grew up on a farm, so I like to keep things pretty simple. So I know, fun, right?
Yeah, super. Got your start early. Was it like with dairy cows?
Oh yeah, like I've milked goats and like cows. Yeah, such skill set. Yes,
Perfect.
So much to learn about
Yeah.
me. So your bladder is like the stock tank, or it's like the gas tank. It's like the holder. The urine comes from your kidneys down these little hoses called your ureters, and then it gets held in your bladder, right? So your bladder is like the stock tank, and then the urethra, where the pee comes out, is like the hose. And it's a pretty sweet hose because
Pretty sweet hose,
pretty
yeah.
it does its job.
Oh my gosh.
And so before kids, before time, which are probably your two biggest risk factors for having some type of incontinence. Both of those systems, the hose and then the stock tank or gas tank, so the bladder. I'm going to use professional words now.
Hose in a tank?
Yeah.
Yeah, perfect.
Yep, totally.
Gardening, urinary incontinence, whichever, yeah.
They worked really well for a long time. And then what can happen is, so you've got your tank, and then you've got your hose, and usually the hose issue, when you laugh, cough, sneeze, that's stress incontinence. So when you laugh, cough, sneeze, lose your pee, jump up and down, and what's happening is, it's kind of wild. So the pressure in your belly, your abdominal pressure, when you do anything like that, laugh, cough, sneeze, you put pressure on your bladder. So you're counting on that pressure on the bladder being letting the hose be stronger and squeezing so the pee doesn't sneak out, right? So like it needs to squeeze. Those little mighty muscles that surround your urethra need to squeeze harder than the pressure on your bladder. So when we have kids, with time, like it just becomes not as squeezable.
Not as squeezable,
right?
term, yeah.
And so the pee sneaks out. So
it
that's
can be a little bit of pee or a lot. It varies
totally
for every woman, right?
everybody, and it depends on what the thing is. And I have patients who are like, oh, my like incontinence or peeing my pants doesn't bother me unless I get like a cold or something like that, or like go to a dance or something where they're more active, doing something a little bit different. So that's stress incontinence: laugh, cough, sneeze, lose your pee. And then there's urgency incontinence. Urgency incontinence has to do with the stock tank. So your bladder is a smart little muscle, and there are nerves that talk to your bladder, and those nerves learn things. So what will happen is your bladder's like, ooh, we're driving in the driveway. That means I get to pee. And so it starts contracting. Or, right?
Yeah.
Totally.
Yes.
Absolutely.
Yes, it's like the closer you get to the bathroom after you have to go to the bathroom really bad, it's like, oh my gosh, it's getting worse, it's getting worse.
Totally. So it's like this battle with the bladder starts like contracting, and if you don't get some feedback back, and it'll keep contracting. I have people who, like, when they see a rest area sign, they're like, gotta go, right? Because they've taught themselves. I go back to like my daughter, when I was breastfeeding her, I was getting up at 2 and 4 o'clock in the morning to feed her, right? So then I'd go pee, and then I'd feed her, and then I had this like aha moment that I was not going to breastfeed this child for the rest of my life, right?
So you couldn't pee.
Yeah, so then I had to retrain my bladder, so I went pee every time I went to go breastfeed her, and that was like hard. You have to like trick yourself into doing that. And then there's mixed incontinence, so that's basically both, a combination of both. Like, some people get really smart and they know if they pee more frequently, that urgency frequency, if they pee more frequently when they laugh, cough, sneeze, much like a coffee cup, if it's half empty, I'm less likely to pour it out if it's always being emptied. So if you laugh, cough, sneeze, lose your pee, you start peeing more frequently, and then all of a sudden you have both. Like, not only am I peeing my pants when I laugh, cough, sneeze, but I have to pee all the flipping time. Normally people pee every 2 to 4 hours. Like, that's a normal time. It's normal to get up maybe 2 times at night. If you're peeing every hour, if you're peeing more than twice at night, like not normal. And then also just in general, if it's like impacting your life to be like a normal human or whatever you consider normal for yourself.
Yeah, sure.
Yeah.
So
over half of women pee their pants. To be very clear.
Half
very
of women,
clear.
50%. 50%.
At least. Like,
so,
it's so
50%.
underdocumented.
There's 3 of us here, so raise your hands. Raise your hands. I struggle. I struggle.
Right? Totally.
So I think that, the more that we talk about this and get it out in the open, the more normalized it becomes. And that's what this is about. We want to normalize these conversations. So I think we can talk about, what does OMC offer that can help women if they're struggling with urinary incontinence? I bet, like, have anybody heard like things that women are doing instead of just going to see their primary about it, right? Like, they're just trying to avoid life things, or wearing pads, or these sorts of things. So what is it that OMC offers?
Totally. So we have, first of all, we need to talk to people about it. And that's what I am oftentimes encouraging my primary care people. So, like, ask questions, because for some reason women really aren't game to like bring this up typically, like that they're peeing their pants. So really we're trying to every year make sure that a woman is being asked about her peeing her pants. And then within our OBGYN department, we've got a couple options. So we have Dr. Chris Klingel. That's his real name, by the way.
Chris Klingel.
Right?
Yeah, I love it. How is that? I can't.
That's a tough break, right? I'm just kidding.
Yeah.
So Dr. Chris Klingel, he is a board-certified urogynecologist. So that means that he did the same training as me, and then did 3 additional years of training just in women's pelvic health.
We should have him on the show. Let's get him on the show.
Yes,
Let's have him on the show.
Oh my gosh.
Sounds good.
Yeah, he's
We'll
going
have him on the show.
Just a down-to-earth person. He's amazing.
Chris Klingel. You're a gynecologist.
Yeah,
the name
down-to-earth guy.
Super love. Every patient that sees him is like so happy afterwards.
Excellent. Cannot wait. Chris Klingel.
Yes, we'll get him on the podcast.
Yep.
For sure. So between Dr. Klingel and the rest of us within our department, if you're peeing your pants, first of all, we have to like evaluate it, make sure nothing bad is going on. What bad can be usually like persistent, urinary tract infections or vaginal atrophy, which we will talk about at a later date. That'll be a fun one. Write that one down.
Yes.
So fun.
I'm glad that she thinks this stuff is fun.
Oh, I love it. It's so good.
I mean, I don't know, like, talking about your vagina and pelvic health is not, like, doesn't top my list of fun times, right?
Every day, all day.
And what is the real name for vagina?
Like you're good with
me.
vagina. Like the outside is the vulva, and then the vagina is like the canal, or people refer to it as the birth canal. That we're gonna do like an anatomy lesson in the future too. Yes, so we know all the parts.
Okay.
Is that fun?
Yeah, I love it. So tell me. So
we got off track.
No, we did, and being mindful of time. Let's talk about one or two things that OMC, and then we'll come back to others later.
Totally.
So what are one or two things that OMC does to assist with urinary incontinence? I heard Botox.
Yes, it's not just for your
11.
11 here. This can be done down there.
Can't wait to hear about that.
This is great. So the neat thing is Dr. Klingel, so think about that bladder. So that bladder is a muscle and it likes to spasm, much like the muscles in our forehead. So you can do this in the office. So Dr. Klingel does this in the office. You don't even have to go under major anesthesia unless you want to. Some people choose to do that.
Yeah.
But he puts a little camera inside the bladder and he's able to put little Botox injections in the bladder, and that helps relax the bladder a little bit so it's not constantly on edge, or like it fights those urges that the bladder has. So it's really cool. Mm-hmm. Insurance covers it.
Does it freeze the muscles like it does in your forehead?
Yeah, totally.
Oh.
Exactly. So it makes it like less reactive. Gotcha. I'm sure Dr. Klingel will have a much more like scientific explanation of everything.
Yes.
And it's long lasting, right?
And it's about 18
some of
months
the other solutions.
At least 18 months. That's the idea, is it should last about 18 months.
Excellent. Mm-hmm. Wow, okay.
Yep, so we have that. And then the most exciting thing that we just started last month is for stress incontinence, the laugh, cough, sneeze.
Okay.
So remember, we've got this hose, and the hose just maybe needs a little bit more bulk to it. So the procedure that we have, it's called Bulkamed.
Uh-huh.
And what it does is it literally like bulks up or plumps the urethra, the hose. So then when you utilize your pelvic floor muscles to squeeze, maybe they could squeeze more and keep the pee from coming out.
So it's essentially a cosmetic procedure for your urethra.
Yeah, totally. It's like instead of lip plumper, it's urethral pumper. Isn't that great?
Is it come in a sparkly tube?
I haven't seen it yet. I should double check. I mean,
that
we
would
could
be
probably.
awesome.
Packaging really is where it's at now.
Packaging is
It's so important.
Absolutely.
It's part of marketing.
Yes.
Britt, get
As
on
you
it.
know, exactly. Bulkamed. I can see it now. Shining lights. Mm-hmm. Anyways.
Bulkamed is also covered by insurance?
Bulkamed is also covered by insurance. It's also, this is what blows my mind, is it's also an in-office procedure. Can be done in the OR, but we're doing them in the office, which is insane. It's our other option that we oftentimes will do is what's called a transurethral sling. Long story, we'll talk about it a different day.
Transurethral sling, yes.
But it's considered less invasive. It's much less invasive. We're doing it in the office. Mm-hmm. So I'm just.
Does it hurt?
I mean, we do our best to like numb the area and do what we can. There's a lot of verbicaine. Do you know what verbicaine is?
No.
Verbal lidocaine. So we're talking to you. Oh my gosh.
Oh, gotcha.
Yes.
It's all good. It's fine.
Yeah, you're doing awesome.
Yes.
Totally.
I didn't know it was called verbicaine. Mm-hmm. I have a lot of verbicaine in my life when I go. Yes. Okay.
That's good, right?
Yeah. All right.
Yeah.
Okay. So we've talked about a lot of things, and I think that these are things that we can cover too in depth in subsequent episodes.
Totally.
But we got the conversation started. There is so much more to talk about at the Pelvis party. So you guys will be back here talking with me on another day. We hope that you will join us too as we talk all things Pelvis party and women's health.
Thanks for tuning in to the Pelvis Party. As we always say, there are no dumb questions, and this is a safe place to ask them. So please drop us a line, let us know what's on your mind for a future episode. And as always, like and follow for more.